Thank you guys so much for the time that you guys used to click this video to learn about the acetaminophen. So the first one is definition of acetaminophen. Acetaminophen, also known as paracetamol, that commonly used analgesic and antipyretic drug to relieve pain and reduce fever. Paracetamol with a crystalline compound H, Ca H9 and O2 that is hydroxy derivative of estanil. And this is generic and patent name. The generic one is acetaminophen in America and Canada, paracetamol in Indonesia. Patent name is the same like the generic name. Dosage of acetaminophen, as you can see on the picture, for tempra paracetamol syrup, there is 30 milliliters, and for paracetamol syrup, it's 60 milliliters. So the next one is tablet forms. You can see on the picture tablet 500 milligrams. For the Panadol, commonly used for pain relief and fever reduce, but direct effective for headaches, colds, and fever. Paramex combines paracetamol with caffeine for change pain relief. Pamol used for pain and fever in children and adults. Sunmol general reliever and antipyretic. And for the tablet, uh, 650 milligrams. It's Panadol Extra. It contains paracetamol and caffeine for relief. For the syrup forms, syrup 120 milligrams per 5 milliliter. For Sunmol, paracetamol-based syrup for children, used for pain and fever. Tempra, safe for children, effective for reducing fever and mild pain. Pamol, often used for children to alleviate pain and fever. Demin, pediatric syrup for treating fever and mild pain. For syrup 160 milligrams per 5 milliliter, Tempra Forte, higher concentration for more effective relief, and Sanmol Forte, stronger formula for persistent pain and high for a fever. You can see the picture on the slide. For drop and suppository forms, drop 100 milligrams per milliliter. Temper drop easy to administer drops for infants with fever or pain. Domin drop fast-acting drops for infant fever and pain relief. Samo drop convenient for dosing infants and young children. And then suppository of 125 milligram. Zamol suppository useful when oral administration is difficult, and Pamul suppository effective alternative for fever and pain relief in children. You can see the picture on the slide. And the next one is suppositoria and infused form. Suppositoria 250 milligrams. Samul suppository, higher dose for severe pain and fever. Pamul suppository used for more significant symptoms in children. And then infused 10 milligrams per milliliter per Falcon intravenous paracetamol for severe pain, typically used in hospital settings. And here's the classification of acetaminophen. Drugs like APAP in molecular combinations, creating prodrugs, codrugs, and hybrids. APAP prodrugs or codrugs are considered merged or conjugated hybrids with structural classification, including carrier link or modified APAP and in and link APAP derivatives. So on the side, there is a classification of hybrids. It's the review proposes a structural classification for better analyze, including chiral link or modified APAP prodrugs and link APAP derivatives products, direct and spacer, NO link, APAP hybrids, or co-drugs. Prime example include propa- propacetamol, benzoylate, acetaminophenol, nitroparacetamol. And of course, if you guys consume some medicine, it have side effects. For the acetaminophen, there is sign of liver problems, it's stomach pain, loss of appetite, tiredness, itching, dark urine, clay color stools, or jaundice, gastrointestinal complication, cardiovascular effects, renal impairment. So stop taking acetaminophen and call your doctor at once if you have signs of liver problems. An overdose can damage your liver or cause death. In rare cases, acetaminophen may cause a severe skin reaction that can be fatal. Pharmacodynamics, plasma versus effect compartment. um, its therapeutic effect depends more on effect compartment concentration than plasma concentration. Effect compartment concentration mirrors plasma but with delays, dependent effects. Maximum effect compartment concentration is lower than plasma after a single dose due to time delays. Target concentration aim for 5 mg per liter for fever reduction and 10 mg per liter for pain relief. Lower concentrations can still produce effects. Pharmacodynamics of acetaminophen are influenced by its concentration in the effect compartment. Understanding these dynamics is crucial for achieving therapeutic outcomes. And for pharmacokinetics, the first one is absorption. Acetaminophen is quickly absorbed from the gastrointestinal tract with peak plasma levels reach within 30 minutes to 2 hours after oral intake. And the second one is in distribution. It has a small volume of distribution. It approximately 1 liter per kilograms, indicating it stays mostly within the blood. Acetaminophen crosses the blood-brain barrier, important for its pain-relieving effects. And the third one is metabolism. The liver metabolizes acetaminophen primarily through conjugation, forming glucuronate and sulfate conjugates, and a smaller amount through oxidation via CYP2E1 enzyme, creating a reactive metabolite. And the last one is excretion. Acetaminophen and its metabolites are excreted through the kidneys. Its elimination half-life is 2 until 3 hours in healthy individuals but can be longer in cases of liver dysfunction or overdose. And conclusion, the pharmacokinetics of acetaminophen involve rapid absorption, limited distribution, significant hepatic metabolism, and renal excretion. This factor influence its efficacy, safety, and dosing requirement. Nursing consideration. The first one is assess. Assess for an allergy to acetaminophen, assess for pain, assess for chronic condition, assess temperature, assess for pregnancy or lactation, assess for acetaminophen toxicity, assess the administration. And the second one is intervention. Routinely monitor the effectiveness of acetaminophen by assessing levels and fever reduction. For patients who are at risk for hepatotoxicity, renal toxicity, the nurse should closely monitor AST and ALT levels and BUN and creatinine. Acetaminophen can cause hematologic reactions. The nurse should monitor for anemia and decrease red and white blood counts, and monitor renal function results as as well as accurate intake and output. And the last one is monitor for signs and symptoms of infection. And the third one is critical thinking. It preventing morbidity and mortality caused by acetaminophen toxicity, obtaining a comprehensive health history with a focus on medication constellation, obtaining an accurate history of the same of acetaminophen in ingestion, the quantity and the formulation of acetaminophen ingested. And for the last one is education to the patient, how to read medication labels, including OTC product labels, and full dosing recommendation. Two, instructed on the various name of acetaminophen, how to measure of pain relief such as relaxation therapy, distraction, physical therapy, and topical heat or cold application. And for teach patients to recognize the signs and symptoms of acetaminophen dose overdoses and emergency procedures to follow if they are having an overdose reactions. Research shows the index acetaminophen on pregnancy safety are ratios with 95% confidence intervals were estimated using a fixed or random effects model. Two, there is not increased risk of preterm birth. Three, acetaminophen exposure during the third trimester reveal not significantly in the outcomes. Four, acetaminophen presentation might the third trimester uncover not significantly within the result. And the third one is critical thinking. It preventing morbidity and mortality caused by acetaminophen toxicity, obtaining a comprehensive health history with a focus on medication constellation, obtaining an accurate history of the same of acetaminophen in ingestion, the quantity and the formulation of acetaminophen ingested. And for the last one is education to the patient, how to read medication labels, including OTC product labels, and full dosing recommendation. Two, instructed on the various name of acetaminophen, how to measure of pain relief such as relaxation therapy, distraction, physical therapy, and topical heat or cold application. And for teach patients to recognize the signs and symptoms of acetaminophen dose overdoses and emergency procedures to follow if they are having an overdose reactions. So next one is indication and contraindication of acetaminophen. For indication, there is dengue fever, typhoid, and urinary tract infections, mild to moderate pain, headache, muscle pain, back pain, post- postoperative pain, pain in the teeth, and osteoarthritis. And for the contraindications, there is decompensated chronic liver disease, severe hypovolemia, chronic malnutrition, G6PD deficiency, phenylketonuria, hypersensitivity to paracetamol, severe degree of active liver disease. For the special precaution of acetaminophen, the first one is avoid overdose. You can check the labels carefully to avoid overdose, especially when using multiple products containing acetaminophen. The second one is liver damage risk. It taking more than 4,000 milligrams of acetaminophen in 24 hours can cause severe liver damage. And the third one is liver problems. Patients with liver problems should take less acetaminophen, and those with liver disease should consult a doctor before using it. Alcohol use. Daily alcohol use, especially when combined with acetaminophen, can damage the liver. And for the pregnancy and lactation, acetaminophen is generally safe for use during pregnancy and breastfeeding, but you can consult a doctor for guidance. And for six, pediatric use weight-based dosing for children under 12 years, and consult a healthcare provider for children under 6 years. Allergic reaction: avoid using acetaminophen if you are allergic to it or any of its ingredients. And other medications: check other medications for acetaminophen content and consult a doctor pharmacist before combining them. And G6PD deficiency: use caution in patients with G6PD deficiency. And chronic malnutrition: use caution in patients with chronic malnutrition. And the last one is skin reaction: monitor for rare but serious skin reactions like Steven Johnson's syndrome, toxic epidermal necrolysis, and acute generalized exanthematous pustulosis. These precautions are essential to ensure safe and effective use of acetaminophen. This is our reference that we use for our materials, and this is also the reference that we use. So that's all about acetaminophen. If you guys have some question, you can asking on the discussion forum. So thank you and goodbye.